Riley Children's Hospital is seeing an uptick in RSV cases among young children. Tonight, Rachel Krause explains what's behind the unseasonable rise in illnesses.
This is very unusual for us.
Over at Riley Children's Hospital, they're seeing an unusual spike in RSV cases in young children. A respiratory virus that normally packs its hardest punch mid-January, now popping up mid-summer.
June, we almost never saw bronchiolitis. Now you hear of children in our emergency room with bronchiolitis being admitted to our floors. We've had also cases of children who are immunosuppressed, immunocompromised, coming down with RSV pneumonia.
Infants and young children being admitted to Riley Hospital, some even to the ICU. Dr. John Christensen says RSV and bronchiolitis, an inflammation in the lungs, is common. Almost every child will get one or the other by the time they turn 2, but it's serious, sometimes fatal.
So it's very, very common. Now, the good news is that you and I come down with RSV will give us a bad cold, right? However, if you're a very young infant, it can put you in the hospital with pneumonia.
So why this unseasonable spike in cases? Christensen says COVID-19 is likely to blame.
We had a season where we had no influenza. We had a season with no RSV, and a lot of the other respiratory viruses like parainfluenza, adenovirus basically disappeared. When mask use start relaxing and lockdowns start being taken down, then we start seeing activity once again on all these.
Global warming, too, could be contributing. Christensen says places with warmer climates tend to see RSV cases spike earlier, sometimes year-round. With COVID-19 now moving toward endemic levels, Dr. Christensen says it's very possible these unseasonable spikes in viruses and illnesses will only continue, just like they're seeing now with RSV.
We may end up seeing these patterns being the new norm, right? We'll have to see.
Well, doctors say a vaccine to prevent kids from catching RSV is in the works, but not available yet. So parents should just focus on prevention, things like washing hands, masking up near babies, and avoiding smoking in the house with an infant.